too much of a supposedly good thing? It's important to start recognizing when recreational alcohol and cannabis use turns problematic. We are creatures of habit, some good, some inconsequential, and some potentially detrimental. When it comes to a widespread habit, many times recreational use of alcohol and cannabis, many of us are confused and understandably unaware about whether or not we should be concerned about our own usage and the usage of somebody we care about. Just how much is too much? And how do we know when casual usage has crossed the line? Let's talk about it and let's identify whether your usage has become problematic. It is important to pause and reflect and look at habits that we once in a while bring in recreationally, but during circumstances, stress, distress, or lifestyle changes in our lives, we tend to bring in more usage of it, and sometimes recreational usage can become a little bit more habitual and habit forming to a point that it can become, dangerous, unhealthy, and affect not only ourselves but our loved ones. These are easily accessed, mind-altering, habit-forming substances used to relax, soothe, or numb uncomfortable feelings or states of mind, like anxiety, stress, or low moods. Many of us want to take the edge off a bad day, a trying situation, or troubling news. Both are perfectly legal in Canada, alcohol and cannabis. But most of us, even if we have never tried alcohol or cannabis, know that there are many people who use these substances regularly, and we're confused either to engage with those people or try these substances or judge them in one way or another. Those who use alcohol or cannabis recreationally are familiar with their pleasant side effects, but tend not to look too deeply at the downside of the usage. But both alcohol and cannabis are associated with serious and harmful side effects and symptoms, and each in their own way can leave users vulnerable to dependence and abuse. At the height of COVID lockdowns, when most retail stores were not open, liquor and cannabis retailers were. Like grocery stores and pharmacies that sold essential goods, they remained fully open to in-person shopping, even in the coldest of months of winter. While the purchase of warm winter clothing was restricted to online shopping, regulators remained steadfast in the choice to maintain convenient access to liquor and cannabis. This rather sobering scenario understandably sets the stage for confusion about whether or not we should be concerned about the use of these legal substances. How harmful can it be? Just because alcohol and cannabis are legal and have been used for recreational usage for thousands of years does not mean they're risk-free. It's important for us to be aware, as a first step to treatment is awareness. Alcohol is well known to be linked to heart disease, stroke, liver disease, numerous cancers, mental health issues, including depression and anxiety, and a range of social issues. Cannabis, while increasingly used by medical professionals for nausea, pain management, anxiety, sleep disorders, and other medical conditions, can also have detrimental effects on mental health, causing damage to the lungs, lowering the immune system, and also can cause chronic use, long-term use, result in cyclic vomiting syndrome, paranoia, and other symptoms. There is also research underway to determine the link between increased heart attacks in younger people and other specific groups diagnosed with cannabis use disorder. Impaired driving due to both alcohol and cannabis is the number one criminal cause of death in Canada. Impaired driving is a serious crime with potentially significant and life-altering consequences to oneself and others. A few definitions. Alcohol is a toxic carcinogen present in varying percentages in wine, beer, and a wide variety of beverages. Cannabis is a psychoactive drug derived from a cannabis plant. Addiction can be defined as any behavior or use of any substance to provide temporary relief from one uncomfortable emotions or situations that negatively impact the life of the user. And despite negative consequences, the user continues to use this behavior to numb, take the edge off, etc. With these definitions in mind, let's look at how much is too much and when casual, recreational usage has crossed the line and become something more problematic and concerning. A new framework With its criteria for alcohol use disorder and cannabis use disorder, the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, provides a helpful framework to determine whether or not the use of alcohol and cannabis is problematic. It is important for us to speak to our doctors, colleagues, references, and resources to determine whether the use is mild, moderate, or severe. While identifying cannabis as a potentially addictive substance may rattle long-held beliefs in its harmless and non-addictive substance, through the lens of its ability to provide temporary relief and numbing, it is a potential to interfere negatively in many people's lives. It falls squarely within the definition of an addictive substance. I've had many patients come in with their family members to convince them that they are addicted to something like cannabis, and many parents or loved ones being confused about it because of their own thoughts of how maybe, we think it's addiction, but it's not. But any substance that we become reliant on to take the edge off can turn into an addiction. How much is too much? Back to the question of how much is too much. General guidelines on safe alcohol use vary and indicate that more than 7 drinks per week for women and 14 drinks for men is excessive. But these guidelines are generic and of limited use. Many cannabis manufacturers recommend not exceeding 40 milligrams per day of the consumption. But since there are many variables when it comes to potency, including THC levels and the method of consumption, the question of safe daily and weekly usage is far more complex and difficult to pinpoint. Plus, we also have to look at our own health concerns. Many times it is good to speak to a doctor to look at other comorbid issues we may be having that we need to be aware of that might be worsening our condition or our health and our mental health. The question of how much is too much is more clearly addressed in the definition of addiction earlier in this article. But if you're wondering whether you are using or drinking too much, the questions that you need to ask yourself are whether the usage is negatively impacting your daily quality of life. And if so, you need to start considering if you can reduce or stop altogether. Many times it is good for us to practice healthy habits if we start finding ourselves going down a path of using a substance to take the edge off a day, day after day. If you are concerned or concerned for a loved one, it is important to be honest with yourself when answering these questions. You are here to be your own best version of you, a higher, better version of you. Please keep that in mind, as many times these type of substances turn addictive and the person it causes the most harm to is you. You need to learn how to be good to yourself, for your organs, for your body, for your mind to function well. As you respect your body will respect you back. And so it's important for you to be honest and conclude that, is my usage becoming problematic or not? And ask yourself, can I really decrease the level of my consumption without assistance? If you need assistance, there's nothing to be afraid of or upset about or think you're weak. That's not the case. We all are supportive beings, that we all need support and accountability buddies. Allow yourself to reach out and get help when you know that you've gone into an area territory where you have gone too far with something. During the pandemic, many people have been relying on more alcohol and cannabis use to just take the boredom away, change life, or numb feelings of financial stress, life stress, work stress, family stress, or the lack of social connection and the isolation that has shown up. It is important for us to be honest and bring some outside resources to help if we need it. Let's take a mindful moment right now, breathing in and out and reflecting on our own life. Have I been drinking too much? Have I been using cannabis more than I should? Even if it's an edible, it is still cannabis. Let's try to pay attention in this mindful moment, taking a deep inhale in and out and reflecting on our own life. Do I have some habits that I could polish up, or I could reduce, or maybe I need help for? Let's take a mindful moment and breathe and ponder and reflect on this. Take a deep inhale in and breathe out. Another deep breath in and breathe out. And let's take a moment to ponder on this. As I gently bring you back from this mindful moment, this moment is about you recognizing if your recreational use has become problematic. If your recreational use or somebody you love is abusing and more used to an addiction of alcohol and cannabis, there are many professional resources, treatment, and supports available to address such issues. You can go to your family doctor first and foremost. They are a great resource for you to, one, be able to open up and ask and ponder if your abuse or use is into an area that you need to get some help. And then the doctor may be able to refer you to certain resources around in your community. We are here to live our life to its best, free of dependence on substances to numb and uncomfortable and avoid uncomfortable feelings and anxieties. Let's face things head on, deal with them, and become better versions of ourselves. Address our issues and vulnerabilities and prioritize self-care. That's important. That's the key to living. Prioritize self-care. But self-care is valuing, respecting, and being kind to your body and mind and your organs too. Let's try to be our highest and best selves. Reflect how much is too much. If you're concerned about your use of alcohol and cannabis, learn more about the potential risks of alcohol and cannabis. Be aware of what you're doing. Ask yourself whether your use has negatively impacted any area of your life: school, work, social, family life, self-care, spirituality, money, etc. Decrease your consumption or quit on your own if possible, and seek professional help and support if you need it. We, each of us, are here to learn and grow from each other. If you need help, it's not a sign of weakness. It's about you learning how to bring something in that is a tool and a resource for your highest and best.